So, good afternoon and welcome everyone to the first talk of your post-lunch, postprandial dip. You probably don't need to know what's happening inside of your body and have a diagnostic tool to tell you that you're maybe feeling a bit sluggish because of what you put in your body just an hour ago. But there are instances where diagnostics can really give you actionable insights as to what is happening. For instance, when you have an infectious disease, be it flu A, flu B, or COVID. So today I'm going to tell you about this wonderful device, this wonderful diagnostic technology we are fabricating, and the specific graphene base upon which it is based. So I think I can skip over reintroducing myself. I will actually just present our company, GrapheneDX. We are a next-gen diagnostic company with the aim to produce digital, disposable, accurate, fast, and discrete diagnostic tools. So to give you a quick overview of why these are needed today, today's infectious disease tests all offer a trade-off. To get clinical accuracy, you have to go to a clinic, a lab. These results typically take more than a day. They're not affordable. They're over $100. And of course, they don't have privacy. Patient has to enter an office or schedule an appointment. So what we aim and what our technology aims to deliver is to deliver on all of these four criteria for both infectious diseases, chlamydia, and gonorrhea in one disposable, low-cost test. So our strong consumer differentiation is that we offer discretion. They can order this test from home, test it at home without any stigma, mailing clinics or contact points. And then, of course, quickly get results in minutes and not days. So this is the device I'll be talking about today, handheld, disposable, with a low cost of goods. And I'll tell you a little bit now about what is at the heart of our technology. Well, it is graphene. I'm sure most of us are familiar with that material. It's a single atom thick layer of carbon. And in this slide, I want to tell you why it's really attractive for sensing. As I mentioned, it's thin. It's highly conductive, so 300 ohms per square. Okay, I've seen a lot of inks here with milliohms, but for a monolayer of material, this is really impressive. And what's really important about its high conductivity relative to its thickness is that it has a high surface area to volume ratio. So what that means is it's all surface, has no depth, right? And if you have any friends like this who are all superficial but no depth, you'll know they're also quite sensitive. Right? So these, just in the same analogy, these sensors are also extremely sensitive to local perturbation. Say one wrong word or put one wrong item or one item close to it, it will actually feel that and be very sensitive to that change. So this sensor, and I'll talk about it in this next slide, is great for sensing because it is not a classical semiconductor in its electronic behavior. It actually behaves like a semi-metal. So, going into the weeds a little bit here, and this will be about as deep as we go. This is a classical field effect transistor, MOSFET. You'll have millions of these in your phone, if not billions. And these all act as digital switches. They turn on and off. Okay? Now, graphene is not a switch, it's a sensor. So it acts more like an analog device. So instead of it turning on and off, it just changes its conductivity when there is a perturbance or an absorption material on it. So let's go from a field effect transistor to a sensor. So to build our GFETs, we functionalize them with capture molecules, target-specific probes, if you will. We can use anything like immunobiologics or aptamers, DNA, for instance. And these probes allow us to be specific to certain targets. So in this instance here, I'm showing you an aptamer that is specific to the SARS-CoV-2 nucleocapsid. And what that allows us to do is to confer cell activity onto the GFET's inherent sensitivity, right? So now we've gone from a GFET, or from graphene to a GFET, all the way to a biosensor in just a little under a few minutes. I hope there aren't too many confusing looks around the room, but now how does graphene actually sense what is actually on the electrode? Well, these molecules carry with them a certain charge, and that charge, that electric field, perturbs the graphene. It actually dopes it, very much like doping a semiconductor material.